the clinical features in patients with the acromegaly, it is what like seen in adults. But what is the age at which these individuals will present clinically? See, growth hormone excess occurs most frequently between third to fifth decade of life. Right, between third to fifth decade of life, that is the point when the maximum growth hormone secretion occurs in case of acromegaly patients, and that is the point when usually the clinical manifestations also occur. Now, if you take the clinical manifestations, your growth hormone, which is nothing but it is showing the action through your insulin-like growth factor 1, that will be acting on the skeletal tissue. So you will have clinical manifestations due to skeletal tissue overgrowth. Number 2, this growth hormone will act on the soft tissue. So these patients with acromegaly, they also have the clinical manifestations of the soft tissue overgrowth, right? And not only that, these patients with acromegaly, remember that is macroadenoma is there. So you have mass effect or local effect within the brain. So you have mass effect of the tumor, right? You have mass effect of the tumor. And fourth important thing is, because of excessive release of the growth hormone, there will be impairment of the metabolism. So there is impaired metabolism, right? There is impaired metabolism in these patients with the acromegaly. So this is what is your clinical features. Number 1, due to skeletal tissue overgrowth. Number 2, due to soft tissue overgrowth. Number 3, mass effect on the surrounding structures within the intracranial structures. And there is also impaired metabolism.